It will be very helpful for us to improve the quality of the presentation. Dr. Solanki and Dr. Wasawa, please. Please off your webcam as well as the mic. It will helpful for us to improve the quality. Dr. Kaushal Wasawa, Kushal Wasawa. Okay, shall we start?
Yes.
Okay, welcome to all the participants in this Veterinary Webinar Series. Dr. Lalit Modi, co-organizing secretary of this webinar series. Today the webinar will be delivered by Dr. Kaushal Suthar, project manager, Equine Welfare Unit Animal Health Foundation, Vadodara, Gujarat, on the topic on Equine Trypanosomiasis. I would like to give some brief about Dr. Kaushal Suthar. Dr. Kaushal Suthar graduated from Anand Agriculture University in the year 2011 and is completed Master in Animal Science by coursework in Charles Sturt University at Australia in the year 2015. Since 2018, means last 3 years, he is working with Equine Welfare Project by Brook India as a project manager cum veterinary officer in Gujarat. So I welcome Dr. Kaushal Suthar also. Before the starting of this webinar, I have a message from our Dean of the college, Dr. V.B. Kharadi sir, Principal and Dean of the Veterinary College, Navsari Agriculture University, Navsari. So I just on the message of the Dr. V.B. Kharadi sir.
Good morning to all. I hope you all are safe and well at your place in this COVID-19 situation. We all know that due to the coronavirus, we all are under the lockdown, which has affected the education of the students. But to mitigate this issue, Navsari Agriculture University, Navsari has developed E-class facility for the students under the guidance of Honorable Vice Chancellor Dr. Sunil Chaudhary. And I am happy to announce that all the teachers of Veterinary College used this facility and completed the remaining curriculum. During the lockdown period, and also successfully completed the online examinations. In addition to this, and Dr. Lalit Modi also started Webinar Series 2020 on the various topics on clinical aspects for the benefit of undergraduate and postgraduate students, field veterinary, as well as the teachers. I that the efforts are made by Dr. Suthar and Dr. Modi to use this critical COVID-19 period very efficiently, the knowledge and veterinarian working in the field through the digital platform provided by the IT department of the university. The Vet NAU Webinar is not for the Gujarat students and veterinarians, but also almost useful globally as per the participant registered in various webinars. I congratulate Dr. Suthar and Dr. Modi for the success of the Vet NAU Webinar Series 2020 and wish them the best of the luck for the future endeavor. Thank you.
Thank you, sir, for inspiring us and best wishes. Dr. Kaushal Suthar, to please start this presentation. Dr. Kaushal Suthar.
Yes, sir. Welcome to all my vet colleagues, respected professors, and my beloved students and field vets. Today I am going to present the clinical talk on equine trypanosomiasis. So there is no need to give introduction about this disease, as we all know and studied this disease during our education, and I am pretty sure that most of the vets in field came across this disease in different species. But here I am like this disease commonly known as a sarra or by the vets and owners. Some common names are also applied to this disease depending upon the localities. Some owner call them as a chakrino rog or chakrika. We can say it is a circling disease. Then some of owner tell it like emaciated animal. So depending upon their observation, their belief, they have given different names to this disease. So we have to also know some of the common names so we can know what the owners are trying to convey into the field condition. Now, this disease is mostly distributed northern and eastern parts of the India, and this disease is mainly mechanically transmitted by the vectors. Most of them are flies. So we have to correlate the availability of the vectors and the epidemiology of the disease, so we can see the later on different slides. And this disease mainly affect the circulatory system, especially we can say it is a hemoprotozoal disease of the domestic livestock and wild animals in India. So this disease is not only found into equines, but most of vets have observed into the goats, buffalo, cattle, and some of the wild species of the animal as well. But here we will give the emphasis mostly to the species equine. Now, the occurrence of this disease is mostly seasonal disease. We can correlate its epidemiology and the season with the availability of the preponderance of the flies, which are mainly act as a mechanical vector for this disease. So this disease is mostly encountered during the rainy season and post-rainy season. If we talk about the Indian condition, then this disease mostly found into the field between July to December months, where the mostly rainy season and the population of the tabanous flies are more due to the weather conditions. Now here in India, there is mostly we have seen into the fields that there is a custom to keep one or two horses or the equines into the dairy farms, buffalo dairy farms or like that. So I would like to say that buffaloes are mostly act as a reservoir for the trypanosoma evansi. So when we see or when we go to the field and we found some incidences or the clinical signs related to this disease, then of course there will be the buffalo population nearby or some lakes or like that. So we have to correlate that first as well in the clinical picture of the animals. When you observe there are lots of buffaloes near, there is a pond or there is a water lodging or the condition favorable for the flies, then definitely there will be the subclinical infection and the clinical infection of the trypanosoma will be more. Now, to identify or to diagnose this condition, mostly the conventional method to diagnose this disease is the collection of the blood and detection of the trypanosomes into the circulation. But these techniques are less sensitive and mostly based on the detection of the trypanosomes. So we can say that it is not almost all the times we can identify or detect the trypanosoma into the blood. So it is less sensitive. Now, why we are not getting trypanosomes all the time into the blood smear? Because more than 50 to 80% of the infections are cryptic and undetectable by the direct microscopy. It requires bit hard work, skilled person, then the correct method of the blood collection. There are less chances to get the trypanosoma if we collect the blood from the jugular vein. Mostly we have to collect the blood from the capillaries, where the chances of getting trypanosoma are pretty much. So all the factors are contributing to detect the trypanosoma into the blood smear. So these methods are, we can say, less sensitive, and we need to go for the more sensitive and the perfect methods. We will discuss it later into the different slides. Now, after diagnosing the control and of this disease into the particular area, it is not only the single approach to control this disease. Actually, we have to go with the combination of or we can say the integrated approach with the inclusion of the proper management, chemotherapy, chemoprophylaxis, and the vector control. However, in Indian condition, chemotherapy and chemoprophylaxis remains the mainstay of the control of SARA in domestic animals in India. In India, we have seen that during the pre-season of the trypanosoma infection or the pre-rainy season, usually the prophylaxis or the chemoprophylaxis for the trypanosomiasis are being done by some of the, we can say, educated or the known owners of the equines, and mostly the chemotherapy. But we are not giving much emphasis on the vector control, which is also as much, or we can say, the more important than the chemoprophylaxis. And there are some, we can say, benefits for the vector control as well over the chemoprophylaxis. So we will discuss. So if we talk about the epidemiology of this disease, as I said, the monsoon and the post-monsoon seasons are most conducive for the propagation of the disease due to the preference of the Tabinus flies. However, the cases of the SARA are also encountered in non-monsoon season, like into the winter, into the summer as well, and we can say almost throughout the year. The incidence of SARA is higher in north and northwestern part of compared to the eastern and southern parts of the India. Still, the epidemiology and occurrence data of this disease into the different states are bit lacking in the information and into the research article. So there is a need of proper research based on the epidemiology of this disease into the different states and district wise. Now, incidence of the SARA in equines coincide with the increased population of the Tabinus flies between the month of July and December. So most of the cases are coming, we can say, into the August and between the August to the November month of time. Now, in this disease, the mostly equines are 100% susceptible and the morbidity is seen, but the mortality rate is 67%, which is quite high. And it was reported in Mathura. Now, highest incidence in Punjab has been reported from the July to December, the same time period as we discussed. So in some states, they have some data are available for the Sarra prevalence, like as we have seen into the UP, especially into the Mathura. Now, for the some states, there is no data available, so we can not discuss them here. Now, transmission of this disease. As we know, the Trypanosoma evansi is transmitted by the various species of the tabulous flies. But the significant thing is that there is no development takes place inside the vector. Efficacy of the transmission is dependent on the interval between two successive feeding and the intensity of the fly challenge. So here, as we have seen that some of the species or the transmission takes place into the vector by multiplying or growing inside the vector. But here the thing is different, that the Trypanosoma evansi, the protozoa are not being developed into the inside the vector. They are just mechanically transmitted from one animal to another animal through the feeding, or we can say the biting. Tabanids are the pool feeder. They cut the skin with their mouth parts and left pool blood along with the connective tissue fluid. So during this time, the transmission of the Trypanosoma evansi usually takes place. Now, pathogenesis, as once the Trypanosoma evansi is entered into the blood or the fluid by the mechanical vector, as we know that they are the blood protozoa, but the visceral forms have been reported in heart, optic lobe, cerebrum, liver, kidney and lungs. So, in nutshell, we can say that the Trypanosoma evansi travel through the blood and lodge into the different parts of the body, or some of the vital organs are also affected, like heart, cerebrum, kidney and lungs. So accordingly, we can see the clinical signs of the animal. Trypanosoma evansi infected animals show the progressive loss of appetite, body weight, anemia, edema of the lower part of the body, intermittent fever and lacrimation and the abortion. So when the Trypanosoma evansi affect the different parts of the body, so as per the parts of body are affected, the symptoms and the clinical signs are observed. So there is a loss of the body weight. Usually the Trypanosoma evansi damages to the blood cells and also damages to the muscles of the large muscles of the body by the release of the lysosomal enzymes and proteolytic enzymes. So ultimately the animal is going to be catectic, then anemia is developed, and due to the lower content, ultimately the content of the blood protein is lower down. That's why the osmolarity is changed and we can observe the edema of the lower parts of the body, especially at the brisket region and lower abdominal portion, and inguinal region is mostly affected. So field vets can observe this sign and correlate it with the infection. Intermittent fever. Intermittent fever is observed when there is a septicemic phase of the protozoa are found. So in this condition, animal usually show the septicemic sign. It got lots of swelling, lacrimation, and sometimes the animal is also going to abort. The temperature is almost ranging from 103 to 107 degree Fahrenheit. Now, the main cardinal role of this Trypanosoma evansi, or we can say why they are most fatal or the killing protozoa, because erythrocyte acquire trypanosomal antigen, which may result in the immunological reaction and complement-mediated destruction of the erythrocyte causing anemia. So ultimately we can say the erythrocyte destruction is being taken place by this trypanosomal antigens. So it will lead to the clinical signs related to the edema, anemia, or like that. Ultimately, the erythrocyte is the protein content of the blood. So loss of the erythrocyte leads to the osmolarity change into the blood, and it will lead to the edema of the lower parts of the body. Now, the second thing, when, as we know, the all cells contain different organelles, and the lysosomal secretory proteinases, phospholipase, and other hydrolytic enzymes are released by the cells or the destruction of the trypanosoma. They are potentially leads to the damage to the heavy muscles, especially muscles of the thigh or the heavy muscles of the body. So ultimately, the animal is feeling fatigue, and also there is anemia. So animal is not coping up with the good energy. Energy is lacking. That's why animal is sometimes shivering, not able to stand perfectly. So these clinical signs are usually seen due to this condition. Now, into the chronic condition, due to the progressive loss of the erythrocyte and some of the damage to the muscles, heavy muscles, and the different organelles, chronic wasting is seen into the month. That's why, as I said before, that this disease is also known as a dubla, or the we can say emaciated animal is seen, which is chronically affected by this disease. And there is a immunosuppression in this condition. That's why most of the chances of having another secondary bacterial infection as well. That's why animal is suffering a lot in this condition. Now, if we collect the blood and observe the blood smear, then there will be lots of abnormality into the blood. There are different kinds of the abnormality of the erythrocytes are seen, and we can correlate it with this disease. Okay, here you can see the trypanosoma. U1C, they are circulating into the blood, extracellular. Then here you can see the abnormality into the shape of the cells, vacuoles. These all changes are observed into the blood smear. But I don't think that into the field condition, when the cases are come, there is a time to see the blood smear and all. You just need to identify the disease or diagnose the condition based on the clinical signs and the very handy test, like you just need to make a blood smear and observe for the trypanosomes, and you have to correlate with the clinical signs like septicemia, temperature, anemia, then the history. History is very important. And then you have to also correlate with the surrounding as well. And some of the epidemiological data are very helpful into the field condition when you doubt for this condition. Now, there is another significant clinical presentation of this condition is seen into the field condition, which is neurological form. So, when you observe the animal suffering from this disease, sometimes there is a marked ataxia. Some animals got blindness and circling movement. That's why this disease is known into the local language, Chakrika Rog. Then some animal got sudden blindness, like within 1 or within 24 or 48 hours, the animal got blind. So this disease, then hyperexcitability, depression, proprioceptive deficit, head tilt, and pedaling movement. So these all are neurological forms are seen in this condition depending upon the various pathogenesis of trypanosoma. As I can say that trypanosoma leads to the significant hypoglycemia into the body. That's why the brain parts are not getting proper oxygenation and energy. So sometimes neurological forms are seen, and there is also simultaneously blood. So sometimes edema of some brain parts are seen. That's why also some of the clinical signs are observed. So we can correlate with the neurological forms. mostly the hypoglycemia is related with the neurological form of this disease. Now, some horses or some animals like showing the neurological signs without evidence of the wasting. This condition is mostly seen into the acute cases where there is a profound hypoglycemia and the condition is acute. That's why there is no wasting of the muscles or the body condition is pretty good, but the animal is showing nervous signs in this condition. So now, the clinical course of this neurological disease is 2 to 20 days, and most of all cases were fatal as per the article, research article. So the clinical course of the neurological disease is 2 to 20 days, which is quite longer, and that's why the field vets or the physician have to take care. There is not only treatment of this disease, but they have to also provide supportive therapy, which is the mainstay to cure the animal in this disease. We will discuss it in later parts. So now the clinical picture or the clinical signs. This is the mainstay for the diagnosis of this disease into the field condition, especially in India, where some delicate test or the ready-made kits are not available in the field for most of the vets. We can make it, but there is also the economic factor which is playing a main role in diagnosis of this disease, and awareness of the owners are very important for this disease. So the first of all, the clinical sign is fever, as there is a temperature ranging from 103 to 107 degree Fahrenheit. And you can observe the spitting of the animal as well. There is a dullness, depression. These all signs are related with the fever in this equine species. Especially into the horses, you can see the neck region and the head. Head is bit depressed and animal is standing, keeping the head sockety or something abnormal with the equine. Second is the anemia. So into the field condition, we have to observe the mucous membranes of the animal. If it is a mare, then you can observe the vaginal mucous membrane. Then there is a eye mucous membrane is very common to observe. Then you can compare it with the color, like as we know that there is a pink, pale and white mucous membrane. So according to that, we can get the idea that how much animal is lacking erythrocytes and the content into the blood. Third thing is loss of appetite. As we know that with the animal, the first sign of any disease is loss of appetite when the animal is not good and especially having fever. The fourth sign is the loss of weight and condition and productivity. This condition is mostly, these signs are mostly observed into the chronic condition. In acute condition, there is no correlation with the loss of weight and the condition and the productivity. So when there is a chronic, when the owner is complaining that my animal is not getting much weight and condition is not improving in spite of feeding good quality of the feed, then of course you need to go for this identification of this disease into the equines. Then fifth, there is a sudden appearance of the nervous signs, as we discussed, that ataxia, then circling movement, and these are the signs very commonly observed in this condition. Now, abortion, cachexia, death, they are the without more peculiar signs related to the host species. So sometimes without showing any signs or any pathognomic clinical signs, and as we discussed, the different manifestations of the disease, animal got sudden death as well. So we have to also rule out, we can't miss the chances of having trypanosomiasis in this condition as well. Now, into the field, when there is a trypanosoma infection, there is we can say there is a peculiar mucous membrane appearance. You can say there is a petechial hemorrhages on the mucous membrane of the eye are seen, especially into the third eyelid. So, most of time there is a petechial hemorrhages on the mucous membrane. Then you have to correlate it with the blood examination. Then you can go for the definitive diagnosis of the trypanosoma. But then, if there are no facility or no any aid is available to diagnose this condition, then you can mostly rely on these lesions into the eye of animal for having trypanosoma infection. Now here you can see most of the time when the vets are being called, the animals are collapsed, they are sweating a lot, they are showing circling movement, debilitated. So here you can correlate these signs with the having trypanosoma infection. Then of course you need to ask owner about having same infection into the nearby area, or you have to observe for any reservoir are being kept near to the horse population. So you can correlate this condition with the animal and you can come to the diagnosis of having trypanosoma. These clinical signs like having collapsed animals, sweating, these all signs are mostly observed into the field, because personally I believe that most of the owners are not being educated and they are not aware about this animal condition, and they are not observing animal very keenly for having loss of appetite, fever. Sometimes what happens, like into the night time, there is a fever for the horse and they are not able to detect the condition of animal. So in the morning they come to the animal got collapse and having this bad condition. So of course we all vets have to not only treat the animals, but we have to make aware about this deadly condition to the owners as well. Now here you can see the condition of animal having poor body condition due to this condition, and as I discussed, here you can see the neck region of the animal. They are keeping the head lower down, so animal is dull, depressed, and having some abnormality into the body. This is the another condition, as I said just few minutes before, that the collapsed condition of the animal due to the circulatory failure, edema of the lower parts of the body, then hypoglycemia. The animal is not able to get up and having circling movements. Now here you can see the testicular edema into the horse affected with the trypanosoma evansi. So there is a osmolarity change into the blood and the fluid is oozing out into the tissue, especially the lower parts of the body. So you can also correlate this clinical sign with having trypanosoma infection. Now, another thing is that the trypanosomes cause severe immunosuppression, which renders the infected host most susceptible to secondary infection and produce poor immune response to bacterial and viral vaccines. So now, when there is a chronic trypanosoma into the animal, it suppresses the immune system of the animal. That's why before giving any vaccination to the horse, like equine influenza or different kinds of the vaccines, we have to do the chemoprophylaxis of the animal, and we have to also diagnose the animal for not having any trypanosomal infection, because this protozoa significantly leads immunosuppression, so there won't be any immunity development against virus and the bacteria even after the proper vaccination. So we have to also rule out this condition before vaccination as well. Now, as we have seen the diagnosis, now here I have some data available from the different researchers in India. So as I say that the demonstration of the parasite into the blood smear, it is a definitive diagnosis for this condition, but the hurdle is that this is not always, if we don't see the parasite into the blood smear, it doesn't mean that equine doesn't carry parasites in their body. Sometimes we can miss the identification and the detection of the parasite in blood smear. As I said, 50 to 80% of the infection are cryptic and undetectable by the microscopy. That's why we have to go for the delicate methods as well. Now, anemia is a major clinical finding. Hemoglobin is usually lower, 3 to 10. That is also one of the reasons why the edema of the lower part of the body are seen. So anemia, for the anemia, we can go for the CBC examination, and also, if not possible into the field, I suggest that every vet should have to develop the habit to examine the mucous membrane of the animal, which gives mostly related idea about the anemic condition of the animal. Now, other includes the reduced PCV, distorted shape of the RBC, as we have discussed. Now, antigen-based ELISA and Suratex are useful in detection of current infection, while the antibody-based ELISA and CAT, card agglutination trypanosomal test, are useful for the seroepidemiology of the cattle, buffalo, and camels. So, now these delicate tests are not much economical for the equine owners, but they are very helpful for the epidemiological study of different area, for different states, different districts. So they can know the epidemiology of this condition, and after that they can do according planning to eradicate this condition. Now, to control this disease and to treat this disease, there are different chemotherapeutic agents are available in India, which include diimidazine acetate, which is commonly known as Baranil. Second is the quinapyramine sulfate and chloride, triquine. Third one is the quinapyramine sulfate, triquine S, and anthracides for the treatment and prophylactic use against the trypanosomiasis in domestic animal. So I believe that all of are aware about these compounds. So here are some of the brands available in India for the same compounds. There is a Baranil, then there is a Virbec manufacturing the quinapyramine sulfate and quinapyramine chloride for the prophylactic, and the triquine S, which is available throughout the India. Now, there is another compound available for the chemotherapy is isometamedium as well. Like different companies are manufacturing this compound, especially in Tas, Sarabai, or like that. And I think the brand names are Sarral or something for this compound. Now, if we consider the therapeutic as compound, they are all effective to treat the Trypanosoma infancy infection in buffalo and in equine as well. Now, if we compare, the comparative evaluation of all four drugs indicated that quinapyramine and isometamedium were good therapeutic agents, but the prophylactic quinapyramine proved better than isometamedium. So, for the prophylactic use, the quinapyramine is a good compound than isometamedium because it provides better protection from this disease for the longer period of time than the isometamedium. Now, to control this disease, as we have observed into the field that most of the approach to control this infection is chemoprophylaxis. Most of the state governments and vets are preferred to do the chemoprophylaxis of the drug before the onset of the rainy season and post-rainy season into the equines. However, this prophylactic use will protect the susceptible animals during the high-risk period, and sick animals must be given immediate attention and proper treatment. This helps in spreading of the disease and reduce the risk of infection and development of the cages status. So it is good to do the chemoprophylaxis, but doing the chemoprophylaxis, we have to also give importance to control the vector as well, because until we control the vectors, they're going to transmit the disease from one animal to another animal. So not only chemoprophylactic, but we have to also use the different method to control the vector for this disease by spraying different insecticide and different, like keeping the cleanliness, and there are some methods being used by the villagers as well. So I would like to discuss that they can also, like if the equine animal or the horse is being kept near to the buffaloes and during the season, they can use the different oils application on the body, especially having the pungent smell like lasun oil, they can apply over the body. So it will protect the animal from the flies, and fly will repel by this oil and animal is being protected. So these kind of the home remedies are also being used, and they are very effective to control this disease. Now, as we have discussed that before adopting any vaccination program for the equines, it is must to clear them for the trypanosoma infection, because this organism leads to the many very significant immunosuppression into the body, and there won't be any benefit if we don't do the immunosuppression. Now, the need of diagnostic centers all over the country. As I have discussed that into the field condition, there is no availability of the kit at very economical price. So they can diagnose this condition confirmatively at the field level. So there are many possibilities of the research for the new students or vets and the veterinary researchers to develop the economical kit for our country. There is a search, as we have discussed, there are very few chemotherapeutic agents are available to control this disease. So there is also possibility to develop some of the chemotherapeutic agents and the immunomodulators to combat this condition. Some of the herbal medicines must be investigated for the treatment of sarra. As I have discussed, that some home remedies using the Ayurvedic oils and like application, and they are also very useful to control this disease, and especially to control the spread of this disease. So there is also possibility to develop this kind of the agent to control this disease. Now, here there should be the regular disease surveillance and the monitoring in healthy animals, because animal is healthy doesn't mean that trypanosoma is not there. The animal may be act as a carrier for the disease, because sometimes immunity of the animal and organisms have made a balance in between, and animal looks healthy, but this animal can be act as a reservoir for the disease. Now, the treatment and control against other disease, deworming and vitamin supplements, they are very, very, very important, especially in these vitamin supplements and deworming, because deworming lowers down the immunity of the animal, especially into the horses, where we have to do the deworming at every 3.5 months. So this condition, by applying this we can control the disease. Now, I would like to discuss some action points for the Trypanosoma evansi. As I have discussed, early diagnosis is very important for this disease because very short period of the time animals die, and it is very killing and deadly condition. So early diagnosis is very helpful to do the proper regimen treatment of the animal. Now, chemotherapy. In chemotherapy, as I have discussed, there are different compounds like diminazine acetate, quinapyramine salts. Then also you can use the isomethylmedium. So this chemotherapy is instituted as per the availability of the drug, and we have to, all vets must have to be aware for the drug resistance as well, because in some area, so they need to be aware for this drug resistance as well. That's why I'm more emphasis on the vector control, especially for this disease, just due to this chemoresistance of trypanosomes. Because if we do the chemoprophylaxis very frequently, then ultimately the organisms will develop the resistance against to that compound, and it won't be helpful for the treatment as well for this condition. So ultimately, we are focusing more on the chemoprophylaxis, but we have to also focus more on the vector control, fly control for this disease. So fly control can be done by the net, then different application of the oil. Some owners are also using Odomos or cream like that. Then they can also mix some of the smoke from the Ayurvedic smoke. They are also doing the fly control. And the bites of the fly are mostly taken place early morning and at the time of the sunset. So during this period of time, they have to control the flies and save the animal from them. Now, immunomodulators can be used for this condition. There is another method that seek animal isolation and the segregation, because it can also transmit the disease to another healthy animals as well. Reservoir, especially buffaloes, they act as a reservoir for this Trypanosoma evansi. So always we have to be very careful and alert when the buffaloes are being kept near horses. Another thing is the field-based kit for the diagnosis. As to collect the blood and examine the blood smear, it is a bit time-consuming and having skilled essential for this perform the diagnosis. That's why it is advisable to develop the field-based kit in future to confirm the diagnosis. Now, how to prevent the drug resistance? That is the main concern for this disease, because using the only one chemotherapeutic agent again and again, it will lead to the resistance to that organism, and it won't be treated by using just one compound. That's why we have to be very careful. We can also ask to honor that which drug have been used for the chemoprophylaxis, and the animal is suffering from the same condition, then we can go for the another compound like the baranil. Sometimes mostly I have observed that quinapyramine salts are mostly used for the chemoprophylaxis into these animals. So while some animal is suffering, then we have to choose another drug for the treatment. So it will be beneficial. Now, if you have any questions related to this presentation, you can ask me.
Thank you, Dr. Kaushal Suthar.
Here I have some questions. I can see into the chat box that some of have asked about the isometer-medium dosage and everything. So the dose is...
Dr. Suthar,
yes, sir.
I will ask one by one. You
Yeah.
just answer. Try to answer this. Dr. Nilofer? Dr. Nilofer? Dr. Nilofer, participants, please just write down your question in chat box. Dr. Nilofer? Dr. Nilofer, can you hear me? Nilofer? Okay, let's start our question and answer session. The first question is from Dr. Syed. He asked them, what is the prognosis when the neurological signs start to appear? Nilofer,
Yes, sir.
please start the question and answer session.
Sure.
Hello.
Kaushal asked,
Yes.
tell me the answer regarding the first
Dr. Syed Mohammed has asked that what is the prognosis when the neurological signs start to appear? Like there is no specific data with the prognosis of the once the neurological signs start to appear. But the neurological signs are mostly related with the hypoglycemia and the animal is collapsed. So it is not that the animal having neurological signs, then animal is, the disease is going to be fatal. It depends based on the treatment of the animal. Like for the trypanosomiasis therapy, in this condition, the trypanosomiasis therapy is not only going to be helpful because you need to more concentrate on the circulatory failure or the circulatory shock for the animal. So you need to establish the circulatory resuccination is very important in this disease, and when the vets and owner are ready to do that, then there are prognoses are good. And I personally believe that we have to always go for the positive prognosis in this condition because it can be treated, but we have to also keep in mind for the economic capacity of the owner as well. We have to explain them for this condition. So there is no specific data is available, but addition is curable.
Okay, thank you, Dr. Kaushal.
Yeah.
The next question from Dr. Arun Ravichandran. What about the dose rate of isometamidine in treatment of trypanosomiasis?
Yeah. According to research articles, medium dose is 0.5 to 2 milligram per kg body weight intramuscularly. But in some companies, they are providing chemotherapy, this agent for the use of intramuscular. But I have observed that some of the non-vets, they are using by the different administration, but it is not good. But I would say that the dose rate of 0.5 to 2 milligram per kg of the body weight is for the treatment of trypanosomiasis in equine.
Thank you, sir. From Dr. Syed, can we use blood transfusion for the anemia?
If it is available, then we can use for the blood transfusion, but I don't think that it is mostly being practiced in Indian scenario. So, but of course, we can develop the facility and we can use the blood transfusion for the anemia. But I would suggest that rather than direct jumping on the blood transfusion, we can also go for the plasma expander colloidal solutions for the treatment to resuccinate the circulatory shock.
Thank you, Dr. Kaushal. Another question from Dr. Asim Prajapati. Dr. Asim Prajapati from the Facebook. He asked them, is Saral can given or not?
Saral is, I think, same isometamedium which is being used for the treatment of trypanosomiasis. So it can be given into the trypanosoma infection at the purity dose.
Okay. Another from Dr. Jignesh Parmar. Is there any scope of resistance development after prophylaxis?
Yes. As we have seen that some of the area there is no response of some chemotherapeutic agent like the triquine is not giving favorable results in some region of country. So there's a scope of resistance development after prophylaxis as well, but not with the single prophylaxis. Like in some area they are using same compound for since many years. So of course there will be the resistance development after prophylaxis, frequent prophylaxis.
Okay. Another question regarding doe urine in horses, which is asked by Dr. Arun Ravichandran. What about doe urine in horses?
That is a different condition. We are discussing here only about Sara trypanosoma ivansi. So
yes, okay.
Yeah.
Another question from Dr. Vinod. Why there is anemia in trips? What is the mechanism involved in anemia development? Second, why there is a ventral edema in affected animals?
Yeah, as I have discussed during my speech, that different entities leads to the immunochanges and ultimately the breakdown of the erythrocytes. So it will lead to the anemia. And when there is a destruction of the red blood cells, then of course the protein content of the blood is going to be changed, and that's why osmolarity, there is a more fluid content into the blood vessels and the capillaries. So ultimately the fluid will ooze out from capillaries and into the tissue. That's why the edema of the ventral area is seen in animals.
Great. Thank you, sir. Another question from the Facebook friend, Dr. Siddharth. Can we use PCR for early diagnosis in this particular disease? Any idea? PCR?
PCR? Yeah, we can use for the PCR, but I don't think that it's going to be practical thing.
Yes, sir.
To treat or diagnose this condition, because we have to also keep in mind for the economic condition of the farmer or the equine owner as well. But of course, it can be diagnosed from the PCR.
Another question from Dr. Gahlot, sir. Baranil is advisable to use in equine?
Yes, it is advisable to use in equine Baranil. I think Baranil is good because what I observed that sometimes there is a mixed infection is also seen into the equines, not only trypanosoma, but also sometimes Babesia is also found into the equine. So if we use the Baranil, it gives a good result. It will cure the trypanosoma and Babesia as well. So Baranil is advisable to use in equine.
Yes, sir. Dr. Harit Bhatt asking about supportive treatment during acute cases.
Yeah, in acute cases, we need to first concentrate to stabilize the animal. As in acute cases, usually we can see the nerve encircling movement, then there is a fever as well. So we just need to try to stabilize the animal. So in this supportive treatment, you can go for the NSAID therapy to lower down the temperature. Then you can start with the trypanosoidal therapy as well. But in supportive treatment, we have to more concentrate to cure the hypoglycemia into the animals. So we can go for the DNS therapy, and also we need to resuccinate the circulatory shock in animal. So in this, for the treatment of this trypanosoma ivansi in acute condition, mostly we need to have a deep, thorough knowledge about the fluid therapy and to combat with the different kind of the shock in animals. So once you can treat those circulatory, especially circulatory shock, then that will be the mainstay for the supportive treatment in acute cases.
Okay, thank you, sir. Another question from Dr. Gehlot. Many neurological signs similar to rabies also. Then how to differentiate at field level?
These many neurological signs are similar to rabies also. That is true, but in field level we have to observe for another signs as well and the history of animal as well. So according to that, we can differentiate the condition like there is a high temperature, then circling movement. We have to, in horse, we have to, first of all, we can't jump based on clinical signs. We have to do the full examination of the horse, especially mucous membranes. Then you can correlate anemia with this condition, which is not found into the rabies. So you need to go for the collaborative approach of the clinical sign to differentiate this condition from the rabies as well. So, and if you have a doubt, then you can go for the confirmative diagnosis by doing blood examination, smear examination. Yeah.
Thank you, sir. Another question is it possible for a salvific transmission from wild equine to domesticated horses, close contact and flies being transmitted?
Yeah, it is possible to have a equine to equine transmission is possible with the vectors.
Thank you, sir. Another question from Dr. G.S. Patel, sir. When to repeat quinopyramine in clinical case?
When to repeat quinopyramine in clinical cases?
Yes.
The quinopyramine compound is mostly used for the prophylactic in the Indian condition. So we can repeat this. This compound will give protection to animal almost 3 to 4 months of the period of time. So we can use this quinopyramine compound in prophylaxis like pre-monsoon and after 4 months of the after rainy season we can use.
Okay, thank you, sir. Another question from Dr. Jignesh Parmar. What is treatment for horse treated with multiple antiprotozoal drugs?
As I understand this question, that the animal is treated with the multiple antiprotozoal drugs, then what is the treatment for horse? So,
Yes.
So it means that the animal is being treated with all antiprotozoal drugs. Then again, which drug we can use for the treatment? You can go for any of the compound and you can see the response of animal, because it doesn't mean that animal is treated with the multiple antiprotozoal drugs since long period of the time. Because if it is going, then animal is not going to be survive for longer period of time, because they are affecting many organs as well. So we have to keep in mind that I suggest that don't give any two like trypanosomiasis drugs together. I have observed the cases where they are giving Baranil and on next day they are giving quinopyramine, and some people are also using 2 drugs simultaneously. So it's not going to helpful to recover the animal. Rather, it will worsen the condition of animal. So I would suggest only use 1 drug at a time and observe the response. And if you have a doubt, then you can go for the another therapy as well.
Okay, sir. Another question from the Dr. Jignesh Parmar. Can we use serum of recovered horse for treatment?
Actually, for this, I don't have any research-based data available to me, but I would say that it won't be practical into the field condition. So, but we need to find out for this question.
Okay. Another question from Dr. Vasudha. Should we use hypertonic fluid therapy to prevent worsening of edema?
Of course, it is a part of supportive therapy in this condition. and it is very good that it is very showing good response if we use the hypotonic fluid therapy. That's why I told that we can go for the DNS. Then 25% D is also being used by the some vets, as I observed, and it is because it will maintain the vascular resuscitation with the hypotonic fluid therapy. So yes, but we need to concentrate first to combat the infection. Then we can switch over to this therapy.
Okay, sir. Another question from Dr. Preeti. Why there is a edema in lower parts only?
It is okay, as I discussed this question before, but here the why there is the lower parts only is the law of the gravitational force. That's why lower parts only there. But sometimes they are also being seen at the eyelids as well. Because yeah.
Yes, sir. Another question from Dr. Sayyed. Sir, can we use furosemide for the edema?
No, furosemide is I would not suggest to use in the equines because of suffering from the in this condition circulatory shock, and if we are using the Lasix, then it will lead to the fluid loss into the animal. There is a actually there is edema is not playing much role in to do the fatality of the animal. It is one of the we can say the side effect of the disease condition. So we have to concentrate more on the resuscitation, then the edema will be resolved automatically.
Okay, sir.
Unless the edema is doing any life-threatening thing to the animal.
Okay, sir. Another question from Dr. Nilofer. Can we use colloids in the treatment?
Yes, we can use the colloids into the treatment. It will helpful for the circulatory resuscitation, and it will also helpful to establish the osmolarity of the blood and of course the edema. Yeah, we have to use we can use, but we have to use colloids into the treatment.
Thank you, sir. Another question from Dr. Harit Bhatt. How much of 25D can be used in acute cases?
As for this question, I would like to say that it depends upon the clinical science, and we have to consider many aspects of the animal, like body weight of the animal, then percentage of the dehydration. So these all factors are contributing to use how much amount of fluid and which fluid to be used in acute cases. So it is not the it will be not good to give a very specific answer for this, because we need to rule out the dehydration, then hypoglycemia and all this condition. Then we can make a proper therapy for this.
Okay. Thank you, sir. Another question from Dr. Sandeep Srivastava. Subcutaneous injection should not be given. Can we use subcut injection?
For what? I didn't get the question.
Yes, I think it is not full. Okay, sir. I think Dr. J.S. Patel, sir, with us.
Okay, sir.
Dr. J.S. Patel, sir, can you please on your mic? Dr. J.S. Patel, sir. Okay, sir. Another question from Dr. Prakash. Okay, J.S. Patel, sir. Please continue, sir. Sir, can you say something? Sir, sir. J.S. Patel, sir, please on your mic.
Can you give DNS or 20% dextrose in a clinical case?
Yeah, in clinical case, we can use the dextrose and the DNS for the treatment or to correct the clinical sign of this condition. But we need to see many factors in this condition. If the temperature is higher, I would suggest that first you need to lower down the temperature, and you just need to treat animal immediately with the trypanosomal therapy once the disease is confirmed. Then once the animal is being stabilized, then you can go for as a part of supportive therapy, you can use DNS or 20% dextrose in these cases.
Okay.
Sir. Thank you, sir. Another question from Dr. Prakash Rajput from Facebook. When icterus develop once, what is the base treatment?
Once the icterus develops, so
What will be the treatment?
Yeah, once the icterus is developed, then once we have to do the clinical management, then you can go for the fluid therapy with the DNS. Then also you can go for the liver tonic in this animal, because I have observed that once the animal got trypanosomiasis acute or the chronic condition, then trypanosomal therapy is not only going to be helpful, because you need to more concentrate on the supportive therapy as well. So you can also, as I said into the presentation, that you need to first concentrate to stabilize the animal, like for the multivitamins, then liver tonic, and also fluid therapy. You need to continue until the animal recovers. So it is a mainstay to get the animal fully recovered from this condition. Then in this trypanosomiasis, sometimes, as we discussed, that immuno animal is too much going down. That's why the chances of having secondary bacterial infection are pretty much. So we need to keep in mind that as well. So we need to diagnose another condition as well with this condition. So accordingly, we have to establish with the probability approach therapy for.
Okay, sir. Another question from Dr. Jignesh Parmar. Is there any classical sign to differentiate from other protozoal disease in horse?
Like, as I understand this condition, that any classical signs to differentiate this disease from the hemoprotozoal disease of the horse or trypanosoma, how to differentiate trypanosoma from another hemoprotozoa. So, as I said, that there is a circulating movement. There are very few signs are seen, like we can say there's circulatory movement. Then you can go for the mucous membrane examination. Then the patagial hemorrhages, they are pretty more suggestive of trypanosoma infection, which is not common in other hemoprotozoal disease. So with help of those examination, we can differentiate this condition in field.
Thank you, sir. The last question from Dr. Kiran Sakil. It is very interesting. Can trypanosomiasis has any effect on reproductive system of mare?
Of course, it have an effect all over the body. So reproductive system is not a new thing to be affected from this condition. As I discussed, sometimes the pregnant mare got aborted due to this condition. So of course, they have many effects on the reproductive system of mare as well. As we can see that there is immunosuppression. If the chronic case is there, then there is immunosuppression, and then secondary bacterial infection is there. So sometimes repeat breeding problem is also. So then we have to go for the confirmative diagnosis for the trypanosomiasis too. So of course, yeah, it is.
Okay, sir. Okay. Thank you, sir, for nicely giving answer.
Okay.
As our participants also, I think they also satisfied. Now we are going toward the ending session. Now I switch over to Dr. Depak Suthar, Organizing Secretary of this webinar series, for his vote of thanks. Dr. Depak Suthar, please.
Thank you, sir.
Hello. Thank you, Dr. Kaushal Suthar. Nice presentations and very well explains. So first, thanks to all the participants who joined with us. I'm also thankful to our Vice Chancellor, Sir Dr. Sunil Chaudhary, sir, for the strong positive support with the valuable suggestions at every time. I'm also thankful to our Dean and Principal, Dr. V.B. Kharadi, sir, for give the every time ready for the helps and give the many useful suggestions regarding the improve this webinar series. And I'm also thankful to the Dr. Pandya sir from the IT department to provide the nice digital platforms for the presentations of the webinars. And special thanks to the Chirag Bhai Nayak from IT department ready for anytime help. So Chirag Bhai, once again thank to you. So great help for this successful of this webinar series. I am also thankful to the HOD of the department surgery, Dr. V.S. Debas, sir, to provide the basic facility regarding this webinar. I am also thankful to my friends and co-organized secretary, Dr. Lalit Modi, every times with me. So each and every time with me. So it is thanks to Dr. Lalit Modi. And finally, thanks to today's speaker, Dr. Kaushal Suthar, for nice presentation and excellent explain for today's webinar topics. So once again, thanks to all the participants joined with us. Now the end of this webinar. Next week, I will come with the new topics, with the new speakers. Same day, same times. Thank you once again, all the participants. Thanks, Dr. Kaushal Suthar. Thanks, very nice presentations.
Institutions, students, and all veterinary team. So it is a good initiative by Dr. Dept Suthar, Dr. Lalit Modi, and Navsari Agriculture University. Thanks a lot.